Dr. Jim Pickert is a professor of medical education at Vanderbilt Medical School in Nashville, Tennessee, and co-director with Dr. Jerry Hickson of the Center for Patient and Professional Advocacy. Their center's work focuses on ways to make healthcare kinder and safer. Please welcome Dr. Pickert.
So, picking up on my colleagues' themes, I want to ask you a couple things. What happens if somebody or some system does not perform well? And you go and talk with the person, the way that Beth described. Can professionals promote professionalism and make healthcare kinder and safer? Well, I do sincerely believe we can, and since I'm the professorial type, I get to show you some graphs. On the left, you will see that our number of lawsuits per 100 physicians over the past decade have plummeted dramatically, and that's good, especially compared with other physicians in the Middle Tennessee region whose trend line is shown by that dotted red line there. And on the right side, you'll see that our community preference scores have risen. These are large surveys taken about all of the hospitals in the very competitive Nashville region. You know, it's good when lawsuits go down. It's good when community preference is up. But it's not just about those things. It's about quality, right? Promoting quality. It's also about, well, preventing some of the failures that cause these lapses in quality in a number of areas. I've listed a few here. Take hand hygiene, just as one example. Back in 2009, early 2009, our hand hygiene rate was 58%. We began providing quarterly feedback to unit managers and institutional leaders, and that barely got us to the threshold goal. And so our leaders decided to step it up a notch and used our center's pyramid, a tiered interventional sort of approach. And you all know about the things at the top, the disciplinary interventions. You also know about these guided interventions by authority folks. But we wanted to prevent more of those things from happening. So when we had data that showed that a unit or a person seemed to stand out, we began to teach what we call awareness conversations. That colleague, for whatever reason, here's some data that suggests you stand out. Non-punitive, non-authoritarian, non-prescriptive. Just thought you'd want to know, and we're confident you can figure it out. But we wanted to prevent some of those as well, so we began teaching the kinds of conversations that Beth just discussed. Those very brave conversations where you tell somebody that they've got spinach on their teeth. I am very fortunate to have many colleagues who have had those conversations with me. Indeed. You know who you are. And so the secret shoppers, the clinicians who were really well trained to spot the non-adherence to hand hygiene, began having those cup of coffee conversations with people who were observed not to foam in or foam out of a patient encounter. And in addition, they dropped their secrecy. So they were having those conversations, but we also began providing monthly feedback to those units that stood out from others. You can see that the annual and the monthly hand hygiene rates are now consistently over 90%. That's good. That's really good. But we're not going to be satisfied, like you're not going to be satisfied till it's every patient every time, right? Yeah. Well, the result has been really good. During that intensified feedback season, you can see that our central line bloodstream infections have plummeted below the expected rate. That's really good. I know the same is true for many of you. So how do we do all that? Well, we had that pyramid. We had a plan. I'll tell you about that in a moment, and we stuck with it. But we started by listening to our patients. In the audience here are Gay Smith and Sean Carroll. Would you guys stand up? I've got to do this. Come on, stand up. Gay, Sean. These are the two that lead Vanderbilt's effort in patient relations. They head up our Office of Patient Affairs. They're the experts. They're the ones who, along with great staff, field more than 3,500 patient complaints telling us that we've got spinach in our teeth. Well, our patients told us some really concerning things. One of the things that they said is that they heard jousting, one professional about another. Dr. X told me I probably got the infection in the OR, said one patient, from a nurse who did not wash hands real well. Or they jousted about systems of care. A patient complained, I told the patient it'll probably take a week to get your blood work back. This place is so inefficient. You cannot imagine how inefficient this place is. Or sometimes we didn't seem to be very caring. I said I had questions about my treatment. Dr. Pickert looked up and asked, "Are you illiterate? I just gave you some pamphlets that explain all this." And since you didn't get it, I thought maybe you could not read. Or read this next one that discusses or suggests that some of our systems of handovers set up otherwise really good people to look really bad. Yeah, you can't make these up. Gay's nodding because she recognizes this complaint. Well, they complain about our not spending enough time. But I love this one. He was terrible with this pregnancy, even worse with the next, but I had to stay with him, kept hoping to get his partner, never lucked out. I'm not getting pregnant anymore because of him. So Vanderbilt's risk manager came to Jerry Hickson and me and said, "Can't you guys get your heads out of the ivory research tower and do something practical?" Well, I said, "What do you want to accomplish?" "Well, we want to increase quality, want to improve safety, we want to reduce risk." Well, Jerry and I had a plan, and we stuck with it. We're also very fortunate to work with remarkably courageous colleagues and leaders at Vanderbilt. But we're not naive. There are lots of things that make it tough to do the conversations that we all have been talking with you about today. Everything from competing time pressures and priorities to leaders who don't back you up sometimes. I know that would never happen to folks in this particular room. Or fear of antagonizing some presumed VIP. But our leaders and our colleagues are also aware of the value that taking these things on can have. Everything from staff satisfaction, community reputation, clinical outcomes, and of course, what our risk manager wanted to hear, reduced risk management costs. And I've shown you the data, evidence-based, data-based. That's going to be a theme throughout this conference. The concept is professionals self-regulate. It's all about professionalism, the kind of professionalism that promotes outstanding teamwork, regulation by one another, self-regulation, shared governance, commitment to mutual accountability. So let me ask you this. Do you really have in your organizations the elements of an infrastructure, a plan for promoting professionalism? These are the 8: leadership, commitment, having clearly articulated goals and values, something like our pyramid tiered model for doing these interventions and promoting accountability, leader training and resources. Do you really have those in your organization? Let me ask you a couple more questions. If you personally posed a risk to quality or safety, and there was a just and fair way to make you aware, would you want to know? Many of you are nodding. Of course you would. I want to talk to the 3 of you who weren't nodding. And if any of your team members posed a risk to quality or safety, would you want them to know? Well, Vanderbilt's physicians and many physicians throughout the country have said, yeah, we'd like to know. And so we use those patient complaints to identify those physicians who stand out. And we have these awareness interventions that we teach local physicians how to do. And the results have been very encouraging. 70%, a couple years later, are much improved. 20% need some of those guided interventions. And the rest seem to take what we sadly call the geographic solution. I count those as failures. I don't like that at all. So sometimes people don't perform well. Sometimes our systems don't perform well. But if you have data and you have some courage and you talk with them about it, I'm here to tell you that professionals can promote professionalism and as a result make healthcare kinder and safer. Now, I cannot wait to hear from Stephanie and Rich, but what I'm really looking forward to is hearing your stories afterwards at the reception downstairs.